I'll jump in here just to share, folks, and not to hijack. We have about a little over 10 more minutes for Q&A. I just wanted to note that we also have time carved out for open discussion. And then if there are questions that don't get answered, we can make note of them and make sure that they're answered after the meeting. Just want to make sure you all are heard, but feel free to keep the questions coming in. So Yolanda, should I read out the next one?
Yes.
Got it. So there's a question about whether we know the number of families to apply the first time during the pandemic and how many people are going through redetermination for the first time.
Any takers on that?
So
Experts?
I can speak to this a bit when it
ahead.
comes to the Greater Newark Health Information Exchange, which has Medicaid data on 3 cities, Irvington, East Orange, and Newark. We have the ability to sort of monitor the aggregate, so the trend in the numbers that were enrolled and attributed to Medicaid prior to the public health emergency and after, but we do not know on an individual level how many people were going through redetermination for the first time. And the data that we do have is can be aggregated by zip code.
Is that something we could request from, I'm sorry, this is Pete. Is that something we could request from social services in Essex County? I mean, right? I mean, they're the Essex County Social Services Office is probably the best source of information, no?
Yeah, I think this is definitely a point where we can use the support of this group, is also understanding how can we effectively pinpoint what this group of individuals is. So that's definitely a plausible suggestion.
I just make a quick suggestion. Usually on the card, it says like when they were initially enrolled, right? So I would default to that. Also, if you can't get like a larger entity, if you want to do it at an individual level and you know, accumulate that data that way while you're helping to research. That's one way. Ask them, you know, like ask them to show you their card and it should say it on the card. Ev, right? There's like a year that's noted when they.
Yeah, there's an initial date on the card that shows when they initially signed up. And that's usually very helpful for them. It gives them an indication of when they'll need to renew. But the best advice that we've been giving, if you're unsure, even from the date on that card, just call New Jersey Family Care, call the county, the Board of Social Services of Essex County. That's your best bet when it comes to really finding out when the redetermination is going to take place for that individual.
Remember, it's not a calendar year. It's not like every January 1st. It's from the time that they applied. So if they applied in May of 2021, they have to recert May of 2022. I'm throwing out a number because obviously it's during the public health emergency. We're not recertifying, but it's not an academic year. It's not a calendar year. It's from the time the person applied.
Mm-hmm.
So if I'm hearing you correctly, everyone's going to have a different date.
Exactly.
Thank
Especially
you.
Children, because they usually go around the birth date, right?
Thank you for clarifying that, Iris. Nikki, where we at?
So I have another question in the chat asking about the Community Ambassador Initiative. So can organizations apply for the Community Ambassador funding? And then are ambassadors trained as family care application counselors who can actually facilitate that enrollment? And then if not, is there funding for application counselors? So some question about strategy to tackle the public health emergency.
So what I'll say to that is those questions are great questions, and we're actually in the process of formulating the community ambassador awareness, doing the training, and then coming up with what kind of funding we'll have and how we'll be able to address that. So stay tuned, which is why in the future we're going to have work groups, and I think Carrie will add to that as well.
Yeah, I think, and Ketlin, thanks for asking that question, and Yolanda, your response. The portion of the meeting today that will be right after this Q&A wraps up is a Jamboard session with some structured discussion prompts to get your input into co-designing what a community ambassador program should look like for our local region. And that includes how funding should be allocated, whether it's to some specific geographic anchor partners, whether it's sectors of the population like youth ambassadors or other targeted populations. So we do, I know Nikki, a great idea to let this go a little longer on the Q&A, and then we do want to make sure we have adequate time for Gemma's Jam Board. Listen to that catchy phrase. So thanks.
Thank you, Carrie.
I do want to just lift up that Anthony has his hand raised and want to pivot to someone that's coming live to ask a question.
Go ahead, Anthony. Good to see you.
Hi, everybody. Good to see you all. Hi, Carrie. Fun fact, I used to work for Greater Newark Healthcare Coalition. Love you guys. Thank you for everything you're doing. And glad to be able to continue that charge here at Clara, Mass. Just a quick recommendation, and I'm not sure if this is part of the next step, but I think we could, collaborate on some frequently asked questions or create a worksheet that will be easily, disseminated to the community in both English and Spanish, at least, being that, our population is heavily Spanish speaking. And, we're happy to support here at the Center of Excellence for Latino Health in any way possible to disseminate that information or organize enrollment events or education events. So I'm really glad that we have this group together and looking forward to connect with you all.
Thank you, Anthony. Good to see you. All right. We got another question. I know we got plenty of questions, and we're not gonna, I know, get to all of them, but during the Jamboard session, that would also be a good time to put your question on the Jamboard, as we try to do the best to answer questions as quickly and efficiently as possible.
Sounds good, Yolanda. So we'll pivot to another question. Ketlin, I have you on your next question. There's one more that came in through the Q&A platform. Would being unemployed disqualify you from redetermination when reapplying for your child?
No, it does not. I'm just jumping in, sorry.
Thank you. Look, y'all on a roll. Just jump in.
Okay. So Ketlin's next question, has GNHCC collected the best of flyers and messaging materials that we can distribute and post at our site? So I know there was some information dropped in the chat box, but just wondering about like other flyers and materials.
So, you guys can jump in as well, but on the site, there is a New Jersey state toolkit that we've been using that has various flyers that have been approved. So that's the messaging that we've been putting out, in the community as CBOs, faith-based organizations. And I'll let Iris, Evelyn, or Laura, whoever else would like to add anything to that.
I will drop the toolkit in the chat box.
Thank you,
as well.
Iris.
Of course. It's in English and in Spanish too.
Awesome.
Okay. Yep.
And that toolkit is the toolkit that GNHCC has been using for the last 2 months. So thank you, Iris.
Janet also has her hand raised, so we'll pivot to Janet.
Hi, Janet.
Hello, everyone. Hi, Yolanda. La Casa currently established outreach events at several faith-based organizations, and we are in need of marketing materials and also volunteers to go ahead and assist us, because we're looking at 300 to 400 kids at each event.
Okay.
All right. So just in case no one knew about New Jersey Citizen Action, we are able to go to your organization and we can enroll right there and then. All we need is a private space. So as long as Janet, for instance, if you need people to help, as long as you have individual space for us, we can come and we can assist as well, and to help your team. All right. The only thing that we would ask is for a marketing material to have your information so that when people come back, that they go to you if that's the case that you want them to. If not, they would become our clients. But definitely.
I have networked with Horizon, United Healthcare, and WellCare, to name a few. I think it's a matter of just communicating via email and just setting up dates at locations, because we have the locations already.
Okay, so great. Sounds like a partnership can be established with New Jersey Citizen Action as well. Thank you, Janet.
Thank you.
This is a question about the notices for families to re-enroll by the March 31st deadline. Have all families received their notices to re-enroll with their coverage?
They've been going out. The packets have been going out even before. We've been hearing even during the pandemic that they've been getting the renewal packets. So the advice that we were giving them is just to fill it out, just to be on the safe side. So there, we have heard from several families that they have been receiving the packets. There are some families that receive the packets that it just indicates that they already went through their files. I guess they're able to access their financials through some system that they use, and it tells them whether this person would need to re-enroll or not. So there's two kind of packets coming out. There's one that's saying that they need to renew, and then there's one that's saying that they do not, that they don't need to do anything at the time.
And just the, you know, when she says at the time, that's the population that they're auto renewing, because depending on whatever types of benefits they're receiving from social services, they were able to verify their income and their eligibility, which allowed them to auto renew, which is, I've been told, is a little confusing, but everyone should be checking, making sure that their address is accurate, telephone number, and so that and if they didn't get it by now, to definitely reach back out.
Yeah,
Which is
Yolanda,
why we're on, you know, we're want to do this awareness so that nobody loses coverage.
I have a copy of that letter. I'm trying to figure out a way on how to take out the PHI information so that I can get it over to you. It's, as Millie mentioned yesterday when we spoke, it is confusing when you first read it. I had to
Yes.
read it like 3 or 4 times. I'm like, it was for my brother, and I'm looking at it and I'm like, oh, okay, the light went on finally. And I said, no, you don't have to do anything. You're good.
Well,
Thank you.
the point, but the whole point of this discussion is having folks know how to identify what those letters, when they do come, right? Because some of them may seem like junk mail, or it's just like piled up. But for them to know to either look for the logo NJ Family Care or like the Board of Social Services logo, right? So that they can pick it out, and whether they have to recert or not, they know that they can then follow up with any one of our agencies, right? To ensure, you know, whether they have to recert or there's no more actions that they need to take, but at least they identify it, right? When it comes in the mail.
And I would even add, just adding the component of still calling New Jersey Family Care to confirm
Absolutely.
it. Because in addition, they've already been sending out termination letters that do not have an end date. So what we're doing is that we're calling to confirm they still have health insurance for the remainder of the month. What does it look like? When can we call back? So it might say you don't need to do anything right now, but by next month you need to do something. So it goes back to make sure that your contact information is 100% up to date. You might as well call New Jersey Family Care and confirm the information that you just received.
Exactly right.
Thank you
Yeah.
both for clarifying that.
Yolanda, I have to jump off because I have
Okay.
another presentation, but I just wanted to thank everybody for this robust discussion.
Thank you so much. Let's thank Iris. She's been a great help to us.
Bye, guys. Thank you.
All right, we're gonna take one more question, and then we're gonna move into our awesome Gemma Jam board.
Perfect. Thanks, everyone. Last question that we'll take for now is, what is the current time frame for someone who is not eligible for Medicaid anymore to be unenrolled?
Evelyn, Gabrielle, let me take a stab at it. Well, wouldn't it be based on when they last enrolled, that date? They would fall off by then? I believe you guys told me it's something like, it's not immediate, but like 30 to 60 days after that enrollment date, right, Evelyn?
That's correct. Yes.
Okay. I was paying attention.
You were.
So just so you know, we know for at least the marketplace is adding it as a qualifying life event. So we do have up to 6 months, but I just wouldn't share that with our clients because we don't want them to have a gap in their insurance. And then now you have to call customer service to get that, you know, straightened out. So definitely the message out there is 60 days.
Thank you for clarifying that.